Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician. And for this episode, I'd like to talk to you about something that's really quite trendy right now. It is total body MRIs for screening purposes. Now, I want to make it really clear. We're not talking about a dedicated diagnostic MRI because someone has a symptom or a specific risk factor. No, that's not what we're talking about. We're talking about doing total body MRIs for what would be called an average risk individual with no symptoms at all. So this is not diagnostic. There's a really big difference here between a diagnostic and a screening test. So a diagnostic test is one that is specifically ordered because of a known serious risk, like someone has a certain genetic condition that would warrant doing total body screening because they have a really high risk of getting varied types of cancers, or they already have a cancer and it's being followed by looking for metastatic disease and that sort of thing. Or, of course, if someone has a symptom and you're trying to work up a diagnostic situation here, like what is going on? Like, say someone has terrible headaches, really bad headaches, and you want to rule out a brain tumor. So that's not what we're talking about. We're talking about someone who is just normal, no problems, no symptoms, and they do not have a genetic extensively high risk for cancers. They're just like average person. Okay, now years ago, I want to go back in time a little bit. I've been around for a while. So years ago, I'm not sure when, like maybe like 20 years ago, what was trendy then? Total body CT scans. And this was so interesting. I'm in California, and they allowed people to self-order these CT scans of their whole body. In fact, in like strip malls and other shopping areas, these CT scan centers would set up and people could just make an appointment or just walk in the door and say, I want a total body CT. And what were they thinking of? Well, they were thinking of cancer. Like, I want you to find cancer if I have it, so to save my life. Well, what happened with these total body CTs? Well, they fell by the wayside for a number of reasons. One, they didn't save like hardly anybody. I mean, there's always that rare case in the crowd, but in general, they were not particularly beneficial. They were not beneficial at all for the vast majority of people. In fact, they were harmful in a similar way to these total body MRIs. Only the CT scans had the added burden of significant radiation exposure to the people receiving these tests. So they were really popular, and one by one, they all just disappeared. And then it became the law of the land in California that you can't just self-order a total body CT scan. It would have to be ordered by a physician, and there was never any medical reason to do that as a screening tool for average risk people. And they all disappeared. Every one of those centers closed up doors, disappeared. Now, fast forward to more recently, like say 5-6 years ago or so, the trend became, well, let's ditch those CT scans with the high dose radiation. We'll replace them with total body MRIs, magnetic resonance imaging. Now, without the contrast dye, many times when MRIs are ordered, they're ordered with and without contrast dye. The contrast dye allows a much more precise picture, and some organs you can't see anything useful unless you also give contrast dye. Well, I'll name a couple. The pituitary gland. If you're thinking that someone has a pituitary tumor, then you would order an MRI of the pituitary gland, and you would order it with contrast dye, the gadolinium. Now, say you wanted to get an MRI of the breasts because someone has, say, the BRCA gene, or they have had breast cancer already diagnosed, and you want to see, is there more breast cancer that's, say, very small that was missed on the mammogram. This is standard what we do when someone is diagnosed with breast cancer. We get MRIs of both breasts with contrast. If someone has high prolactin, then we would get an MRI of their pituitary gland once we rule out hypothyroidism and other such things. Additionally, abdominal MRIs will often be much better when they're done with contrast dye. So they're not doing these total body MRIs including the gadolinium contrast dye. So just right out the gate, you just need to know that there are many types of cancers that would not be found because you can't find them without adding the gadolinium. And even the ones that you can see something, it's not going to be as precise. It's also difficult to pick up a lot of lung lesions that are cancerous because you have to tell people to hold their breath, but some people can't. Any little movement will make the image distorted, and all the oxygen in the lungs makes it harder to see on just a simple non-contrast MRI. So there are some limitations even of the type of imaging itself. But why would I recommend or not recommend a total body MRI? Going back to the CT scans, I must have been given about 50 certificates to have free total body CT scans for myself, or I could give them to a friend or a relative. Guess where they all landed? Recycle bin. I didn't use them. I didn't have them on me. I didn't give them to anyone in my family because the last thing I wanted was unnecessary radiation for myself or for someone I cared about or anybody. And I knew the data. The data for the total body CT scans were that the chances of actually finding something were remote at that moment in time that you happen to have it. The chances of finding something that is nothing but now needs some kind of follow-up or workup is significant. Well, let me tell you a real story. It's actually a tragic story. Someone I know, and this is going back quite a number of years now, gave her, well, I'll keep it, more anonymous, gave a relative a free CT scan, a total body CT. This individual had no symptoms, nothing. It was just totally screening. Well, what did they find? They found a small aneurysm of the artery going down towards the leg. Now, it's true that aneurysms can rupture, but not all aneurysms rupture, and this one was not huge, and this is an older individual. So there's risks to doing vascular surgery on aneurysms. Well, my friend decided that this relative should really undergo the surgery and look to find a good, reputable hospital center to do the surgery for this aneurysm. The surgery was done. It did not turn out well. It turned out terribly. The repair leaked. More surgery was needed. The individual suffered a heart attack and a stroke, ended up within a year, I believe, it was not very long, had more complications like another heart attack or stroke, and then ultimately died, all from the complications of the surgery for this incidental finding of an aneurysm. Now, that's a very big deal. What about another story? Well, I had a patient, and these are all the CTs, but the CTs have the same issue of finding things that were never going to create harm, but the act of working them up or following them creates harm. And we're going to talk about more of this issue called incidentalomas. A patient of mine underwent the total body CT scan, and the main difference, by the way, between the CT and the MRI is really the radiation for the CT. That's why they ditched that, and now they're doing the MRI, but without the gadolinium, which also limits some of its ability to see stuff. So anyway, this patient of mine had bilateral incidental findings of small nodules on both of her lungs, one on the right and one on the left. And it was unclear what they were. Like, she had no symptoms, but nobody knew what they were. She ended up going to the Mayo Clinic where they did bilateral surgery. They couldn't reach these simply. They actually had to open her chest cavity on both sides, going like through the ribs, to biopsy the lesions on both sides. They felt it, and she was so nervous. She just wanted to know, do I have lung cancer? Do I have lung cancer? Well, they were both benign. Both sides were benign. She had bilateral surgery in her chest on her lungs for incidental findings. And it took a long time to recover. And if she, fortunately, unlike this other individual, did not have a serious complication from the surgery. Now, I can tell you it happened with my dad. He had an incidental finding of a very, very identical aneurysm, but it wasn't through a screening test. He had a fall, and as part of the fall, they did a lot of scans of his body, looking for incidental fractures and such. And they found this incidental aneurysm, and they wanted to call a vascular surgeon in immediately to do surgery. He had no symptoms of anything, and it wasn't that big either. So looking at his age, he also was older. He was around 80. I said, no, like whatever happens, happens. You know, we keep his blood pressure is good. These things happen. We're not going to do surgery. Well, my dad lived to 98, almost 20 years. That aneurysm never ruptured. I mean, I'm not saying no aneurysms should be operated on. I'm just saying that these are just examples of incidental findings where you can have good or bad decision making, but it's not always clear what is the right decision. So sometimes not knowing is actually, it seems weird, but is actually the better part of valor. Well, let's talk about these total body MRIs and why I don't tell my patients you shouldn't do them. I just say I don't recommend them. If someone wants to have it, go and have it done. Just know what you're getting. You know what we call that? Informed consent. You should know whenever you do anything, the pros and the cons, the risks and the benefits, whether it's surgery or an imaging procedure. Nothing is without potential harm. That's like a really important thing to know. There's not just benefit. Well, why would I not want to get a total body MRI? It might find that early cancer, like in that little critical window before it becomes metastatic, and my life is saved. Well, the medical probability of that happening is really low, but it sounds so good. Like, what's the harm? Why don't I just have a total body MRI? And there are many doctors that are encouraging their patients to do these, and I do not encourage. I don't say don't do it, though. It's personal choice. I'm totally in favor of personal choice. So why would I prefer not to promote, and I don't promote, that everyone should get these? We're talking about not diagnostic, remember. These are just routine screening total body MRIs. Well, here's what the estimates are of what we call incidental findings. So we call them in the medical world incidentalomas. So what is an incidentaloma? Well, it's finding something that was not going to ever do anything. It's just found. Now, usually we talk about incidentalomas like what my dad had. You're looking for breaks in the bones, but then you see an aneurysm. So that would be like you're doing an x-ray to see if someone had rib fractures, and you see a little doodad on the lungs. Those are like classic incidentalomas. Of course, when you're doing an MRI, you're looking for doodads. So I guess you could say nothing is exactly an incidentaloma, but I'll call an incidentaloma a finding of no significance, but nobody really knows that when it's found. So it's found, but nobody knows what is this thing going to be. Is it going to be something dangerous? Is it nothing? This is the problem. It's built into these really sensitive tests. It finds a lot of stuff that is meaningless, stuff that will never hurt anybody. That's one reason why it's not recommended that all women, not just cost, but for other reasons, like I'm going to say, that all women don't have screening MRIs of the breasts, because you're going to find so many little doodads that are not cancer. They're not anything. But now you're stuck. Whether it's this type of thing, a screening test of the breast, for no obvious reason. That's why they don't recommend it. And there's enough issues with mammography, which I'm not going to get into right now, with false positives or, incidental findings or just findings that turn out not to be cancer, or cancers that we're never going to kill. Another story altogether. Not all cancers grow. Many cancers stop or regress, but we don't know which ones will or won't. So nobody's going to sit around and just wait to see what happens in the vast majority of cases. Prostate, sometimes yes, but we're not going to go there. But let's go back to incidentalomas, or these findings on MRI of lesions, little doodads that are not significant. Well, it happens all the time. In fact, the data is that when you do a population of asymptomatic, normal risk people, and you do total body MRIs, what percentage will find something that is not important, but now I call it, you're going down the dark rabbit hole of medicine. Now, something is found. We don't really know for sure if it is something significant or not, but now you're stuck because you found it. So what percentage of findings are not important? They're not anything that will ever do any harm, and you're doing this, you find this with a routine screening total body MRI. 20 to 40%. So, that's really big. So a minimum of 1 in 5, up to 2 in 5 of all the people scanned are going to have these findings that are not significant, but now you're stuck. So what does it mean that you're stuck? You're going down what I call the rabbit hole of medicine. And it's a big, dark, deep rabbit hole. Well, you're going to have more imaging. And this is probably now going to include either contrast dye or typically things like PET scans and CT scans. So suddenly now you're dealing with real radiation and potential harmful issues in terms of the added risks that are carried by doing these more advanced screening techniques. And even then, you're not sure what it means. So then you get more. So you're going to get maybe CT scans every 3 months for a while to look for stability. Meanwhile, how do you emotionally feel? Like, oh my gosh, they found something on my pancreas. What does that mean? Is it cancer? Is it nothing? Or they found something that's in my lungs, and I said lungs are not always that easy, but you can still see something, so what is it? It's easy enough if someone finds something in their colon, we'll just do a colonoscopy. They probably should have had one anyway. But no, we're talking about in these organs that are not easily diagnosed. So now you're really stuck. What happens when they see something in your liver? Well, most of the little doodads that are found in the liver are benign tumors. There can often be like what they call hemangiomas. That's like a little blood vessel tangle. But now you're going to have more imaging. You're going to have follow-up. You're going to have repeated imaging and anxiety. These tests give a lot of PTSD. Women, especially, I deal with them by far the most, are more prone to post-traumatic stress disorder. Anxiety creates PTSD. So people are found to have these little doodads in their lungs, in their liver, in their pancreas and such, and nobody knows what they are. They're not causing any symptoms, and now you are on this train without brakes. It's like imaging, imaging, and imaging. Or you could end up like my patient who had the bilateral doodads in her lungs, and she had surgical biopsies. So people can have needle biopsies. That's done by the interventional radiologist. They can have open surgical biopsies. Don't think these don't happen. They happen all the time. So 20 to 40% of all the people undergoing screening MRIs will have an incidental, insignificant finding of something that is not going to be just walked away from, because nobody really is sure. And the doctors are not sure. What is this? We don't know. That's where going on this like wild witch hunt looking for cancers in asymptomatic, low or normal risk people is often a very dangerous, fruitless, not fruitful endeavor when you are the one who has the false positive findings. Now, but you may say, but it's worth it. It's worth it to be in the 20 to 40% false positive group or incidentaloma finding, because I could also win the lottery, the MRI life-saving lottery, and my life will be saved. They'll find this cancer in this tiny window while I'm still salvageable and savable. And what's the chance of that happening? 1 in 100,000. Yes, you have to screen. I mean, nobody knows for sure, but this is what is estimated: 100,000 people in this asymptomatic normal risk population to save maybe one life. So do you think that you're going to win that lottery, or do you think you'll be in that other 99,000, and who will undergo harm? So why do I not recommend this? Because I go with what it's called medical probability. Do I look like a fortune teller? Where's my crystal ball? I don't have one, okay? So I don't read tea leaves. I don't know astronomy. I should say astrology. I do know a little astronomy. I don't know astrology, so I don't know your horoscope. I don't know how to predict the future in someone who has no particular risk and has no symptoms of what's going to happen in the next 6 months, okay? I can't be sure of that. We do take histories. So if someone has a family history of, say, repetitive melanomas, they have lots of colon cancers, they have lots of pancreatic cancer, that's not your normal risk person. And those people should definitely undergo genetic cancer screening. And I actually don't have a problem with people getting genetic cancer screens, because if you even don't have a family history, but you want to know this stuff, do you carry any genes that increase your risk of certain types of cancer? Fine. That's not a bad thing if people would like to do that. I don't usually target random patients who have no particular family history, but if you want to do it, that's like just a swab, like a saliva swab in the mouth, or it's a blood test. And knowing your risk is not a bad thing if that's what you want to do. But imaging tests are another story. So, in summary, the chance of a random MRI, just at any random time that you just get it, okay, that MRI is going to save your life is not zero. I'm not going to say it has zero potential to save your life, but it has approximately a 1 in 100,000 chance of saving your life, and it has a 20 to 40% chance of harming you through the finding of something that's not significant. By the way, what if you do have a total body MRI and it shows nothing? Does that mean you could take a deep breath and say, I don't have cancer? No, you can't say that, because not finding cancer doesn't mean you don't have cancer. Because I already told you there are certain organs that are not well seen with an MRI that is not produced or done with contrast dye, and not everything is findable at that moment, and there could be artifacts, movement, and so there are some limitations. MRI is not foolproof. So a negative finding on your total body MRI doesn't prove you don't have cancer, and a positive finding of something doesn't mean you do have cancer, but now you are stuck. Nobody's going to walk away from it. Nobody's going to say you have something seen on your pancreas or your liver or your lungs or some other organ and say, what the heck, we don't care. Nobody's going to say that. So you're going to go through a lot of workup and follow-ups, possibly different kinds of biopsies and even surgery for nothing. And if you don't think this is anxiety producing, then you are a different kind of person than myself and most everyone I ever see. So it's your choice. If knowing what I told you, you think that a 20 to 40% false positive rate, incidentaloma findings that are not going to prove to be of any value to you, you think that that's not a problem, and the idea that you might be that 1 in 100,000 who is found to actually have a cancer that maybe you can save your life because it was found just in that amazing little window of opportunity to find it before it became metastatic, then you should do it. It's your call and it's your money. It's not cheap. Insurances won't cover a routine total body screening MRI. So, expect $2,000, $2,500, something in that neighborhood to fork out for this test. And maybe you'll be that one. I would love to hear from you if you find that you do a total body MRI and it saves your life. I keep asking people who are getting them. And, some people do find cancers. It doesn't happen too often, but in just about every case that I know of, it was not a life-saving thing. The cancer was already metastatic. So it's like, that's the problem with a lot of screening tools. By the time you find it, it's already, the die is cast. The future is set. It's already metastatic. And so you didn't really save a life. You did make a diagnosis. And that's true. Like I mentioned, there's some colon cancer screens with stool that have detected cancer. But in order to screen and find cancer, you have, like, out of 10,000 people who are screened with the stool test, you might find 4 cancers out of 10,000 screenings of average risk people with no symptoms. This is not a diagnostic test, it's a screening test. And of those 4 that are found to have cancer, it doesn't mean you save their lives. It's often already metastatic cancer. So you find it, but you didn't change the ultimate outcome. And the other thing to always know, which is very hard for a lot of people to grasp, but every cancer doesn't kill. Some cancers grow so slowly that you'd have to live to be 200 before they could kill you. Some cancers regress. So finding a cancer doesn't even prove that you saved someone's life. But the important thing, I always say, is informed consent. If knowing the pros and cons of having a total body MRI leaves you with the feeling of, I just want to do it. I want to do it. I want to know if I have cancer. I mean, understanding it may miss cancers, it may find a lot of unnecessary findings, but you think you're going to be that special lucky one. You might be. Who knows? Let me know. And whatever you do it with your eyes open and aware of the pros and cons.